Greetings and welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health Center reporting for the week of April 26th. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit questions in the comments, by direct message, or by email to admin@rootsclinic.org. As of April 26th, Alameda County has 85,727 total COVID cases and 1,486 deaths from COVID-19. Hospitalizations, including ICU hospitalizations, remain about the same, stable, and we have good hospital capacity. And deaths among skilled nursing facility residents remain the same as last week at 301. This is unchanged, which is good news. Vaccination rates continue to increase, and we now are at over 67% of those who are eligible, so those 16 and up, have had one dose, and over 41% are fully vaccinated of those over age 16. So we are improving at a good rate, but still we're nowhere near herd immunity. And vaccination rates do remain uneven. Here you can see on the left, we have test positivity rates over the last 28 days, and those two zip codes in dark blue are 94621 and 94603. So those are the zip codes that still have the highest test positivity rate, double to triple that of the county average. And as you can see on the right, when we look at percentage of fully vaccinated, it almost looks opposite, where the areas that are being the most affected by COVID-19 are also the ones that are protecting themselves the least with the vaccine. So today I wanted to talk about the J&J, which has been unpaused, and just by way of review, the Johnson & Johnson vaccine was granted emergency use authorization on February 27th, and then it began being distributed here in the United States on March 2nd. And on April 13th, the CDC and the FDA issued a notice that recommended the pause of the Johnson & Johnson vaccine. And so it was paused from April 13th, and this was due to a rare finding of a specific type of clot in the brain, cerebral venous sinus thrombosis, that was occurring in combination with low levels of platelets in 6 individuals. And I went over this in detail in a special briefing on April 16th, which you can find on Facebook or YouTube in case you are interested in those details. But 10 days later, on April 23rd, the Advisory Committee on Immunization Practices met virtually for a 5.5-hour meeting, which is publicly available on YouTube if you're interested in taking a look at that. But basically, the 15-person advisory committee met virtually. They heard presentations, they reviewed data, they heard some public comment, they heard more presentations, reviewed more data, and they deliberated. And at the end, they voted to resume or unpause the Johnson & Johnson vaccine and restore it as it was under the emergency use authorization. So what should we do with this information? Should we be worried? Should we be not worried? And this might depend a little on who you are, what your options are, and your individual circumstances. For example, your age, gender, and also the likelihood that you can complete a 2-dose vaccine series, because we know that the alternatives are 2 doses as opposed to the one with Johnson & Johnson. So we just want you to be aware and see some of the information that the advisory committee contemplated in their decision as you contemplate yours. And mind you that the ACIP was weighing a lot of factors, not just the risks, but also they were weighing factors like the fact of the deadly pandemic, the implications of not having this vaccine available, the fact that the Johnson & Johnson vaccine is an important tool that's especially favorable in several different settings and also preferred by a lot of people because of the one dose. But where I'm going to focus here is on those adverse reactions themselves, because I think that that is information that is most important at the individual level as you weigh out your risks and benefits. So again, the pause was in response to the 6 cases of thrombosis or clot with thrombocytopenia or low platelets syndrome. So now they're calling this TTS, thrombosis with thrombocytopenia syndrome. And after the pause, more cases were identified for a total of 15 cases that they reviewed and discussed. Now, where did they get this information from? Well, there are a couple different sources, but the main starting point is the VAERS, or Vaccine Adverse Event Reporting System. And VAERS is really like an early warning system. This is a joint system between the CDC and the FDA, and it accepts reports really from anyone. So this could be from patients, from their caregivers, from parents, from doctors, from hospitals. It's just like a big repository. So if you go in there, and anyone can actually go in there, and you can see a long list of things from A to Z with reports that are basically from anyone. And it's like a big receptacle for information of anything that happened after the vaccine. And so this could be anything that was because of the vaccine or not because of the vaccine. It's really not intended and is not designed, and it does not make determinations about whether there was any cause and effect or was it just a coincidence. That's really the job of reviewers and scientists to take a closer look. But really, the VAERS just receives all kinds of quality of information, and it doesn't make any kind of determination about that. But what it does is it offers a signal or kind of a warning sign for those reviewers and regulators to then be able to take a closer look. And so this is where they were able to identify the 15 cases, and then they were able to go deeper into each of those cases and get some of the specifics to then gain a better understanding of what it is we're looking at. And so as you can see here, there was 15 cases that were identified, and 13 of these were in women 18 to 49 years old, and 2 were in women 50 to 60, and none were in men. So does this mean that no men can get this? No, it doesn't mean that. Does this mean that women over 60 can't get this? It doesn't necessarily mean that either. What it does seem to mean is that what we are seeing so far is a clustering of cases in women age 18 to 49. When we take a closer look and see how many people had this adverse reaction compared to how many within that group were vaccinated, that is what gives us the reporting rate to indicate that we are seeing this cluster in the 18 to 49-year-old women group. And so, as you can see, when we look at the 13 cases compared to over 1.8 million doses administered, that gives us a reporting rate of 7 per million. And that equates to about 1 in every 143,000 people who received the vaccine. And that's based on what has come in so far, based on what we know so far. And in women 50 to 60 years old, you can see that more in this age group were actually vaccinated, while less in this group had TTS. So when you do that math, this is a reporting rate of less than 1 in a million, so 0.9 per million. And notice that I am saying reporting rate, I'm not saying risk. And that's because it's really still too early to calculate the risk just yet. And so right now, the reporting rate for men in both of these age groups is 0 per million, but we can't say that we have a 0 risk in men because, again, it's just too early to calculate the risk. And I'll remind us, this is just like it took us months to determine the fatality rate of COVID-19 in the United States. And it wasn't until we really had enough cases and enough deaths that we could establish that risk with confidence. And we've been able to establish that that rate of death in the US, if you have a confirmed case of COVID, has remained pretty steady and unchanged at about 1 in 56. And of course, that is higher if you are in higher risk categories or older age group, and lower if you were in lower. But that is the average. But again, it took us time to have that stabilize and for us to really be able to then establish what the risk was. And so until then, we are talking about reporting rate. And so while the adverse reactions being reported with the J&J are looking quite rare, it's still an evolving situation, so we'll continue to keep an eye on it. And the regulators and scientists will continue reviewing data and any additional reports that come in. But as of April 23rd, the ACIP made the decision to resume as we were with the Johnson & Johnson emergency use authorization. And the next day, on April 24th, the Western States Scientific Safety Review Work Group, which is comprised of California, Nevada, Oregon, and Washington, and this is a work group that has been in place since the vaccines were approved under the emergency use, and has been doing its own independent review of the federal processes, including the one I just described. And they concluded on April 24th that Johnson & Johnson COVID-19 vaccine should resume in the Western states. They were very clear that there must be informational materials that accompany the vaccine that are culturally and linguistically appropriate. They're available in multiple languages, and that they would be at an accessible reading level in order to provide information on the rare risk of TTS after receiving the Johnson & Johnson vaccine. And then the next day after that, on April 25th, for those who's here in the Bay Area, our 8 Bay Area counties plus the city of Berkeley public health departments put out a joint statement, essentially agreeing with the ACIP and the Western States work group that the Johnson & Johnson should be resumed. And you can find this on the Alameda County Public Health Department website. But I wanted to point out a couple of things here, and these are my highlights. That after they kind of go over the reporting rates that I indicated earlier, they then issued a reminder that, on the other hand, the risk of dying for those with a confirmed COVID-19 case is 1 in 56. So as opposed to the less than 1 in a million or the 7 per million, when you have a confirmed case of COVID, the risk of death is 1 in 56. And they also supported the Western States work group recommendation about the warning label and how the information needs to be in understandable language on the potential risks. And then they also pointed out here that the longer you wait to get the vaccine, the greater your risk of catching and spreading COVID-19. So we have here the federal, the state, and regional sort of levels, good agreement about a path forward with respect to the J&J. But what about the fact that we did not get a unanimous decision from the ACIP? So I want to clarify here what the ACIP was actually voting on. So early on, the committee all agreed that they did not want to limit the availability of the Johnson & Johnson vaccine. They all felt that the benefits far outweighed the risk of the vaccine for the 18 and up population. So they were not interested in anything that would include taking the vaccine off the market for all or even part of the population. So that was actually not under consideration at all. So what they had narrowed it down to, and what they were really contemplating, were these two choices here. The first is that the vaccine would be recommended for people 18 and up as before under the FDA's emergency use authorization. The second would be that it would be recommended, but that women age under 50 should be specifically made aware of the increased risk of thrombosis with thrombocytopenia syndrome, and may choose another COVID-19 vaccine authorized for use in the United States. And essentially 10 liked the first choice and 4 did not. and one abstained due to a conflict of interest related to their involvement in the clinical trials for COVID-19 vaccine. So 10 were essentially in favor of reinstating without any change, no additional language. And I'm summarizing what I heard. And again, you can find the entire meeting online. But in summary, what I understood is that those in favor felt that the added language in choice number 2 from the ACIP would introduce confusion unnecessarily, and that warning language, which would be added in the clinical information by the CDC, would be sufficient. And some also remarked that they felt that the pause had been effective in putting everyone on notice, from the public to healthcare providers, and that the ACIP itself did not need to put forward additional language. And of the 4 who voted no and spoke to their reasons, what I understood was that there was a sense that the public should receive specific guidance specifically from the ACIP, so that the warning would be sort of upfront and that it would be clear that the ACIP felt certain that TTS, even though it's rare, is serious, and that it is almost certainly related to the vaccine, and that there are other options, namely the mRNA vaccines. So essentially, there seemed to be a desire for stronger language coming directly from the committee. So I think there was agreement that the public should be informed about the risk, but there were some differences of opinion on how strong that language should be and at what level that language should be offered. So with the decision, the CDC issues updated language, and then it is a responsibility for really communicating the issues. It kind of comes down to the state and local levels. And luckily, as I mentioned, our state and county are committed to ensuring that there is accessible language provided to anyone choosing to get the J&J vaccine. And that will likely include potential warning signs. And I'll review those again. So within a few weeks of receiving the J&J vaccine, warning signs of that cerebral venous sinus thrombosis clot, that is a clot in the vessels that drain blood from the brain. Those could present with severe headache that does not go away or get better. That could be accompanied by nausea and vomiting, visual disturbances, even stroke-like symptoms, weakness on one side, or even seizures. And because there were also other clots associated with this, we want you to be on the lookout for severe abdominal and back pain. And these are not your normal stomach ache or back pain. These are severe and not improving. Also shortness of breath or chest pain. And then there's the matter of that low platelet count. And with that, it may manifest as tiny red spots on the skin or bruising. So if you've gotten J&J in the last 3 or 4 weeks and any of these things happen, we want you to seek medical attention, and please advise the hospital or a medical provider that you recently received the J&J vaccine, and present your card if possible. I think every medical provider at this point knows all about this, but you'll want to make sure that they order the appropriate test before they start treatment on you, because in this case, the usual clot treatment could actually be dangerous. And so it's important that the provider knows you received the vaccine and when, so they can provide unique treatment that might be required in the situation, and also so that they will do that reporting through the VAERS system. So, as I mentioned, part of the deliberation of the ACIP had to do with the importance of vaccines as a tool to fight this deadly pandemic, which is still raging in many parts of the world and even in parts of this country. But luckily, here in the United States, we are also in a fortunate situation where we have 2 other vaccines aiding in the fight against this pandemic. And I think we all know that these are different technology. These are the mRNA vaccines as opposed to the adenoviral vector vaccines. These are the main vaccines that have been used for the longest in the United States so far. So far, the vast majority that have been administered here are the Moderna and Pfizer. There have been no cases of this TTS with the mRNA vaccines. And the safety profile on those overall, again, continues to look excellent. And so here is just an overview of the features of these 2 types of vaccines. Not a whole lot of difference between the Moderna and Pfizer vaccine. So really the mRNA vaccines are the 2-dose regimen, the mRNA in a fat droplet, and the Johnson & Johnson is the DNA and an adenovirus vector, and it's only 1 dose, actually lower side effect profile in general than the mRNA vaccines, but both are 100% effective at preventing death and incredibly effective at preventing hospitalization and severe illness. Now, remember, these are not really head to head comparisons here because the trials were done at different times in different parts of the world with the presence of different variants. However, the most important thing is that it really is preventing death and severe illness with any of these vaccines. And we've probably all heard the advice that was, the main advice up to a couple weeks ago, that we should just accept whatever vaccine is available to us. This was certainly the guidance before the pause. Before we knew about these rare cases, but also it was the guidance when the demand for the vaccine far exceeded the supply. And so that was the best guidance for our thinking at that time. And if at some point the J&J becomes the only vaccine available to us, or if we end up in a situation where there's some kind of scarcity or insufficient supply again, then it will be a different calculation. But at this point, I believe that it is reasonable for each person to be able to make a choice between the mRNA vaccine or the J&J vaccine. Now, I don't see any compelling reason to choose one mRNA vaccine over the other, the Moderna over the Pfizer. They're really so similar. But between the mRNA or the J&J vaccine, I think depending on your individual preference, perhaps your age and gender and your comfort level, that you should be offered choice and be allowed choice. So we know that vaccination is one of the most important tools we have in fighting this pandemic. And unfortunately, at this point, we're really not seeing another way out of the pandemic. So if you have been waiting for the crowds to die down to get your vaccine, you didn't want to wait in those lines wrapped around the block, now's a good time to get your vaccination. The Coliseum, the pods, the pop-up sites, the clinics all seem to have pretty good capacity at this point to accommodate you. So we're in a very different situation than even just a few weeks ago. And we are hopeful that these sites will, especially now, will make it clear which vaccines they are offering on which days or which times so that you'll know ahead of time. And we think that you should have that choice to make at this point. Will it always be this way? We really don't know. Will we end up in a situation where we have a limited supply of one over the other? We really don't know. But right now, we have a good supply, really, of all three vaccines. And you should be able to make the decision that is best for you. And of course, not forget the other layers of protection, and those include masking, distancing, hand washing, and in your indoor spaces, we want to sanitize and disinfect and ensure that there is good ventilation and filtration. So, we really want to continue to avoid crowded, poorly ventilated spaces because even with masks and spacing, at some point, you will essentially all be breathing the same air. And the main exception to this is a properly fitting N95 mask, which gives you that filtration right on your face to protect you in high risk settings, like, for example, if you're working with the public in an indoor space. If you get symptoms of COVID 19, even if you're vaccinated, we really do want you to go ahead and get tested, isolate yourself until you get those results. If you are unvaccinated and you are exposed, wait 5 to 8 days while you're isolating. Get tested and continue to isolate until you get your results. And if you are in a high risk category, unvaccinated, and you test positive, please inquire about monoclonal antibody treatment. If you have chronic medical conditions or if you haven't been checked out for them in a while, please reach out to your primary care doctor. Get your blood pressure and your sugar and your cholesterol checked. Do what you can right now to stay in tip top shape, vaccinated or unvaccinated. We want you to stay in tip top shape. Keep up your good nutrition, your physical activity. Take a multivitamin and additional vitamin D supplementation, manage your stress, and get a good night's sleep. That concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.